Trump administration has reshaped the website once used for information on COVID and test kits. This is what you see now. Picture of the president that reads, "Lab leak, the true origins of COVID-19. CBS News digital reporter Alex Tin joins me now. Alex, catch our audience up on how this thing changed, what it now looks like, and what it emphasizes and what it has basically erased.
Yeah, so Major, you're exactly right. You know, that website, which is titled The Lab Leak, The Real Origin of COVID-19, which is hosted by the website, is what you will get to if you go into your web browser and you type in covid.gov or covidtest.gov. You know, those websites used to host a lot of important information about how to find COVID tests, how to find COVID treatment, how to find COVID vaccines. And what's interesting is that while the website's substance itself isn't particularly new, in fact, the website says that all of that information is coming from a report by House Republicans that was published last year. So again, nothing new in that website except for some new graphics and new web design. What has changed is where those covid.gov links go. And that matters because actually there are still websites on the CDC's website, on the FDA's website, telling people, please go here to find out more information about how to get COVID-19 treatment. And now they're getting redirected to this White House webpage. An HHS spokesperson told us that they're right now in the process of trying to catch up and change all of those websites. But clearly this was rolled out before any of those updates could be made.
And Alex, I'm not here, and neither are you, to adjudicate whether or not the lab leak theory is a conspiracy theory or not. It is debated, has been debated for years, and there is more evidence that people have looked at that suggests it could possibly have originated in a lab in Wuhan, China. That part isn't what's particularly odd about this. What is, it strikes me, interesting is that things like Operation Warp Speed that created the vaccine, as I understand it, not there anymore, or not even referred to.
Yeah, that's right. And, you know, look, part of this comes as the Trump administration has really tried to shift gears and, you know, they say essentially move past the COVID-19 public health emergency. One of the reporting that we have is actually this same month, at the same time that they're pulling down all of these websites, they've also instructed all federal agencies to take down any COVID-related signage in their facilities. We actually spoke with someone who works in a healthcare clinic that's run by the federal government who found out about that directive as their nursing staff was going around taking down any sign that happened to mention COVID-19 in order to follow this directive.
And you have interesting new reporting on measles. Alex, what is it?
Yeah, that's right. So, you know, as people know, there were major layoffs at the Centers for Disease Control and Prevention. One of the most significant part of those cuts was for a part of the CDC called NIOSH. They deal with worker safety, occupational safety, and very importantly, they deal with one specific topic that's dealt with nowhere else in the CDC. That's ventilation and filtration. A team from NIOSH had been deployed to Texas. They were in the process of helping hospitals fix errors in how their ventilation was working. At the same time, they were helping to treat measles patients. Those responders were laid off as part of those cuts. They're now off of the response, and a plan that they had to help Texas schools curb the spread of the virus, that's also now been scrapped because all of the staff who were supposed to work on that are now being subjected to these layoffs.
Alex, there's also new reporting about potential FDA changes dealing with health and food safety.
That's right. So, you know, our reporting on this is interesting because the FDA has actually been planning, some officials within the agency for a long time, for the possibility that routine food safety inspections would be moved from the agency out to the states. This sort of outsourcing of the inspections is something that a lot of conservatives have proposed as a way to save money and essentially bring that authority back to the states. Now, viewers at home can probably imagine the criticism that some advocacy groups have of this kind of move, which is the concern that when you have this patchwork of states that are doing food safety inspections instead of the federal government, that undermines confidence in the U.S. food supply, especially since a lot of people aren't buying food that was made in the same state that they're paying taxes for. This plan, to be clear, is not finalized yet, but it's our reporting that the planning has resumed around this plan at the instructions of the Trump administration.
A great deal happened in this space this week. Alex Tin, always a pleasure to have you with us to break it all down. I thank you very much.
Thank you.